Alrighty. All right. So how's everything going this week, everyone? Good. We got some new people this week, so everyone clearly has gotten into Moodle, hopefully, to be able to kind of see some of the things that are going on. Yes, no. So this week we're looking at diagnostic imaging and dentistry. Yes. This is so quiet.
Hi.
Hi.
Hey, Beth, how do we find out what this week is? Because when I look online, and it might be for the next week, it says anesthesia this week. The little bubble says anesthesia.
Oh, goodness. Okay.
Yeah, mine says pharmacology
Oh,
for
no.
this week.
Very weird. Okay. Let me check really quick. That shouldn't be like that. So let me go back. And your guys' might be because you guys are maybe some of the pharmacology is it has the bubble in it. That's weird.
Yeah, so if you look on the left side, when you hit the 3 lines, there's a little blue bubble that says this week, and mine says anesthesia, and I guess Hannah says pharmacology.
Yeah.
Yeah.
Interesting. Okay.
Mine says diagnostic imaging and dentistry, if that helps. But that might just be because it's like my first week.
Right, right.
Okay, Madison, way to brag. Just
Exactly. Right. No, that's really helpful because I don't see that on my end. So that really helps me now. Like I don't get to see that.
And Beth, I can email you a screenshot. So that way you can see what it looks like if it doesn't show up on the instructor end, I'll use a screenshot for sure.
Yeah. So yeah, no one's ever mentioned that too. So that's the funny thing. Everyone's always like, okay, Beth, whatever you say. I'm just looking through all of the courses to see if I see it. Let's see, section 1, pharmacology. Interesting. Yeah, and like in the other courses, I don't even see a bubble saying this week. So that's the really weird thing. The only one that I see it in is the new section. Weird. Okay. And I'm sure what gets caught up is probably once you guys get through the bottom and then it starts rotating through the top maybe, but I'm not quite sure why it's doing that. Oh, okay. Interesting. Wonderful. I'll have to figure that out. Well, we'll just go over what you guys have questions on first. We'll just do that, and then we'll kind of just go through some of the content that we were planning on doing. So you guys were working on this last week. Let's see. So we went over emergency and critical care last week. You did pharmacology and you did anesthesia, you said?
Yeah, I did pharmacology.
Okay. Pharmacology and then anesthesia. Okay, perfect. All right, so let's go over questions that you guys had in general. So anyone have questions in general on certain things? 'Cause pharmacology and anesthesia are very, very similar in certain aspects. Anyone else go over anything different?
Good morning, Beth. I did. I actually saw the magazine, the nurse magazine.
Yeah.
And I actually was I had a question about I put into practice the urine specific gravity information.
Yeah.
And it was pretty interesting because I had a question in regards to when you dilute the urine for 1-to-1. It says there to multiply by 2 the number after the decimal, right?
Yes.
Okay. Could you just explain it? So I actually did it.
Yeah.
And I think everybody in the clinic was like, oh, because it was off the chart. Like the urine was not even showing on the refractometer.
Yeah.
So I was like, oh, I think we need to, dilute. So I did. And then I multiplied it. And the doctor was like, oh, okay.
Yeah.
So it was actually, I was happy for myself and proud at the same time because I had just read that. And I remembered
really
a little
good.
bit in school.
Yeah. No, that's a really good point, honestly, because there are a lot of times where we read the refractometer, right? And so like you'll here we go, me drawing a picture, right? So we'll read our refractometer and like how you have at the bottom, oh my gosh, I can't draw. You'll have your 1.000, right? And then you'll have like your little dashes, right? And then it's like 1.010, and then it'll keep going, and then 1.02, and then it keeps going, right? And then by the you get to the top here, it's like 1.050, and then if you have urine that goes above here, right? A lot of people will just say, oh, it's above 1050, right? Or it's greater than 1050. So what you did, which is really cool, is that you diluted your urine down 1-to-1, right? So you took, whether it was 1 drop of your urine and then 1 drop of saline, and you mix them together, because we know that your distilled water is, the specific gravity is just 1, right? So we can just say that. And so when we do that, we know that when we get our specific gravity here, it's going to bring your urine specific gravity down to hopefully a level that we'll be able to read, right?
Yeah, I noticed that it was still high anyway, but at least it showed in the graph. Yeah, I noticed that it was high, but at least it was now on the actual, graph. You could actually read it.
You could read it. Okay.
Yeah.
So what was it when you read it?
Oh, it was 10, I think like 8 or 9.
Okay.
Or above that. Yeah, it was high. It was still up there.
Okay. So
it was
maybe
1008 or something like that.
So 1008. So
yeah, it was still kind of almost at the top of the graph. And it
okay.
was, I guess, yeah.
So we'll say for our purposes here, maybe that it was like 1040. Okay. So 1040. So say your urine was up here. So which is still fairly high. Then all you need to do is, because you know that you already diluted it, we know that there's two parts here, right? Right? We had 2 drops of something. And so if you don't dilute it, if it was just one part, you know, just your one urine, we don't need to multiply it. You could say, okay, I did multiply it by 1, right? Because you have one part of something. But since we have 2 parts and we have this, we need to multiply by 2, right? So we take our 1040 and we multiply that by 2, and that's how we get our answer. So we're going to end up getting, we have to leave this though, because this is going to be our constant. So we're really just leaving, we're multiplying just this part. So it's actually going to be 1080. Okay. So say it was still really high for some reason, right? So we wanted to put some more saline in there. So like 2 drops of saline. So 1, 2, 2. So 1 drop of urine and then 2 drops of saline. We then know that we have to multiply that by 3. So then we would change this to 3.
Oh, okay.
Which again, this would not happen in real life because that would be very, very concentrated urine. But
Right.
that's how you figure out like dilution. So same thing would happen if you needed to dilute blood or anything to that nature.
So you pretty much, for urine, you leave the 1 alone, but you just the numbers after that. And you could do, if you wanted to do 2 drops of urine and 2 drops, as long as it's the even amount, right? I mean, as long as it's a balanced amount, or how would I say? Okay.
Yeah.
2 to 2, 3 to 3.
Yeah.
Okay.
Just to make your life easier.
Yeah. Awesome. Thank you.
Of course. Does that make sense to everybody? Yeah. So if your doctors really want to be obviously very specific on that, because I mean, technically it might just be 1060, right? Or it could be really, really, really high, which we then go, well, why is it so high? Are we dealing with something, you know, really bad, or you know, what's going on? So it is kind of nice to have a better idea of like what the actual number is. And same thing goes for like when you get blood results back and say like your ALT might read like greater than, I don't know, 500, right? I'm just making up that number, but greater than 500. Your doctor may say, I really want that diluted down. So you will take like your serum and you will dilute that down. So you'll, you know, instead of doing like your blood that you normally do, your machine will allow you to dilute it and everything. So there are a lot of machines that already give you a dilution option and will dilute it for you and then do the math for you. Or you can just run it like a normal sample and then do the math at the end too. So you can say, okay, well, I'm doing 1 drop of serum and 1 drop of my distilled water, and at the end I can do my math, so it comes back out to being, you know, if you're not doing the math, and it says, okay, well, your ALT is, you know, comes back at 540, right? And we didn't do the math on the machine, then we have to go, okay, well, I have 2 parts here, so I need to multiply this by 2 to get my actual real ALT, right? And that would be 1080.
This might be kind of like a dumb question, but for ALT, like I kind of struggle with like the test results, like our blood work back.
Yeah.
So having a high ALT, like why does that mean that we have to dilute it right away? Like we should probably think about diluting it anyhow.
Yeah, right. So obviously it's really good to know for any of our blood work what the actual test result is versus just having like that greater than or whatnot, because it could just be slightly above this actual, you know what you get. But what does ALT, or where does ALT come from anyway?
Liver.
The liver, right? So what is ALT, like what is ALT kind of known for? I refer to it as the check engine light of our liver. So if you obviously have a car and you ever have your check engine light go on, anyone ever have your check engine light go on? Y'all have nice
Yeah.
cars, right?
Never turns off.
Yeah, it never turns off, right? So, but if your ALT goes up, or your check engine light goes on, normally your check engine light, if it goes on, it should at least alert you that, hey, like something's going on and you should be looked at, right? And so if our ALT is high, it's kind of the first sign that like something's going on in our body and we should really start paying attention to what that is, and that soon more could be to come, right? And so sometimes the ALT can be just due to, maybe some trauma that has happened, like, a hit by car comes in and the ALT will go up because of a trauma, to your body or whatever. And with, fluid therapy and supportive care, the ALT will go down, right? But typically the ALT is there to kind of just alert you that, hey, like other things are happening within the body. So we need to start paying attention to it. So it's a really good indicator of like what is actually happening. So, if your ALT is just slightly above normal, hey, we need to start kind of paying attention and kind of doing some more diagnostics to see like, really, is there anything going on? And maybe doing some supportive care with our liver to make sure like we are not having any other issues that are going on, right? So it's just kind of that nice thing of knowing like where that number really is. So same thing with like BUN and creatinine. Like it's nice to know that number. Like for our BUN could mean that or I should ask, what is our BUN there for? What does it represent or anything like that?
I know what
for
it's
the kidney.
Okay, so it's like a kidney function type of thing, right? So if our BUN is high, does that mean like we have kidney disease?
No, it could be dehydration, I think.
Okay, good. Yeah, it could be dehydration. It doesn't necessarily mean like, oh my gosh, you are dying from kidney disease or anything like that. But it is definitely an alert, right? It's like, all right, let's figure this out right away, right? We are definitely more concerned when we have our creatinine that is higher, right? So it is good that when we start seeing that the BUN is high, that we kind of address that right away so that we don't see that creatinine going anywhere either, right? Where do we see BUN fluctuate where it might be lower? Like a low BUN.
Could it be the kidney disease?
Ooh, what kind of kidney disease?
Oh.
Would Addison's, like any like Addison's or Cushing's, like have to play with that a little bit or no?
No, not necessarily. I
Okay,
mean,
Could it be
I haven't done fall
diabetes?
animal in a long time. Is it malnutrition?
malnutrition, maybe, in a sense, definitely.
Diabetes?
Not
trying to
for
think.
low.
I'm thinking a toxicity also, but I'm not a disease.
Okay.
I'm trying.
So not necessarily the low, but you can have a toxicity and that them be high, definitely.
What about fluid overload?
I'm sorry, fluid overload?
Yes.
Let's see. Maybe not necessarily fluid overload. You could definitely be a little bit overhydrated and you shouldn't have it be, it wouldn't be super low. You're still constant, you should be still concentrating your urine pretty well if your kidneys are functioning okay.
It's, what to say, kidney failure?
Yes, what type of kidney
Trying to
failure?
remember.
Yeah.
It wouldn't be like Lyme disease, like that type at all, would you think? Like if
No. What kind of kidney failures do we have?
Are you talking like chronic and acute?
Yes. So we have chronic, acute, and then we have some people have probably seen some of these animals come in. End stage liver, or I'm sorry, end stage renal failure. Because
okay.
yeah, it'll shift it from being really high to extremely low because their kidneys are just not functioning at all. Also, if you have ever seen animals who come in, so puppies and kittens can have just slightly low BUN. So if you ever see them come in, their BUN might be just a little bit low. So that's kind of an interesting thing to kind of look at some blood work and then go, oh, this might be a puppy or a kitten just because their BUN might be a little bit low. So what about malnutrition? Somebody mentioned malnutrition. Why malnutrition would cause the BUN to be low? Oh no, we're back to nutrition again, right? What do our animals need a lot of?
Do they need protein?
Yeah. And so just think that malnutrition where they're not getting great protein sources or a great amount of protein that they really need can cause them to have a lower BUN as well. So if you see an animal who may be like overly skinny, and that's a great opportunity to kind of like ask those questions of, hey, what are they currently eating? How much are they eating? That type of thing, you know. And even if they're like eating appropriate things, this could be like a protein losing neuropathy or something to that nature too. So if you guys are really into internal medicine and that type of stuff, or IBD or all of that stuff. So it gets to be interesting little cases there.
So with protein losing enteropathy, their BUN will be low too?
Can be. Yeah.
Okay.
Yeah. Because those guys become those malnutrition types of things, even though they may be eating, you know, good food. It's just that they can't keep it in. Right.
Okay.
Yeah. Those guys are rough. All right. Good question. So what about our what is we talked about, someone mentioned toxicity of bringing our BUN or even our creatinine and raising that. What are some toxicities that we do have to worry about for raising our BUN creatinine?
Antifreeze?
Ooh, antifreeze. Okay, so what's our active ingredient in antifreeze?
The glycol.
Okay, the ethylene glycol. Good.
And it makes like crystals, and it can like
Ooh.
plug the urethra and stuff, right?
Yeah.
Yep.
Okay, good. So anyone ever see antifreeze toxicity?
Yes, at the ER. And
Yeah.
it was sad because the people waited over 24 hours. So when they brought the baby in, she was making crystals, and the veterinarian was really bummed because it was a baby golden.
Yeah. Yeah.
Because they didn't come in early enough.
Yeah. So there's a lot of So I've seen it obviously in antifreeze. There's also like brake fluid has same ethylene glycol in it too. So there's like multiple other things that have ethylene glycol in it. So you just have to be like careful. Of course, we just say like try not to keep your animal in the garage because you may have things in your garage that have ethylene glycol in it, obviously. But you're absolutely right. It is a toxicity that progresses really fast. We had a patient that came in right away after they ingested it, and it was like 36 hours later that the patient was euthanized. Why is it that an ethylene glycol toxicity progresses and that we can't really make them vomit the ethylene glycol up like we can for many other toxicities?
It will, the esophagus, it'll hurt the the esophagus too coming out if you try to make them vomit.
Okay. Not necessarily.
Is it because it just absorbs so fast that you'd rather just treat the clinical signs and like all things are going on before initiating the vomiting? Because once you just start on fluids, kind of just try to flush everything out, kind of try
Yeah.
to.
Yeah, so unfortunately, yes, you're right. Ethylene glycol toxicity is that it gets absorbed so fast that we can make them try to vomit, but the unfortunate thing is it just like when you guys are pouring alcohol, right, on a body or on yourself or whatever, it absorbs really, really quickly, or it evaporates really, really quickly, right? So ethylene glycol itself is going to absorb into tissue and all of that very, very quickly. And also the amount that an animal needs to ingest is such a small amount to become toxic to them. So it is something that we do need to treat regardless. What are some things that we need to look for in ethylene glycol toxicity?
Could it be like jaundice kind of a little bit going on?
Okay.
Urinalysis.
I'm sorry.
I'm sorry, do a urinalysis.
Good. Yeah, so I think a good baseline urinalysis would be good. And then, yeah, we continue to do urinalysis on those guys as well. So like you said, we're going to be looking for crystals. And what type of crystals are we looking for again?
Is it calcium oxalates or calcium dihydrates?
Yeah, calcium dehydrate. Yeah. Very good. What is something we really have to do for these guys as well? Especially since we know it causes nephrotoxicity, right? So it's toxic to our kidneys. And over a very short period of time, we know that it can hurt the function of the kidney. So what is something that we need to monitor with the kidney?
Have them on fluid therapy.
Good. Fluid therapy, right? So we need to flush those kidneys out really, really good. Very good. And then what else?
So the urine output.
Good. Urine output. Very, very good. So what is our normal urine output for our animals? At least our normal urine output.
2 mgs per kg.
How many? I'm sorry.
2 mgs per kg.
2 mils per kg per
Hour, I believe it is.
hour. Okay, yeah.
Do
So
it.
it'll be 1 to 2 mils per kg per hour is our normal urine output. So when you have a patient in your ICU or your hospital or whatever, that's a really good way to tell, hey, are we giving them too many fluids? Are we not giving them enough? Is to say, all right, are they at least meeting these requirements of that 1 mil to 2 mils per kg per hour? And if they are under that amount, obviously they're not getting enough fluids, right? If they are over that amount, we might be hydrating them too much. So in these cases with nephrotoxicity and stuff like that, we probably would place a urinary catheter in them so that we could really monitor their urine output, right? So that we can know that they're completely matching and stuff to that nature. Now, obviously, we can't place a urinary catheter in every single patient that comes into our hospital to monitor, urine output. So in other cases and stuff, how can we monitor urine output? Or how do you guys monitor urine output for the most part? I mean, sometimes it's like relative or kind of vague, right?
Because when you take them out of their kennels, you take them out in the back to use a restroom.
Yep.
So you could just monitor how many times they're urinating out every hour.
Yeah, definitely. And you're monitoring subjectively, right? So whether you guys write like, oh, they urinated, X amount that you saw, whether it was you guys have a charting system of 1+ to 4+ or whatever, and that you guys have figured out how much that really looks like or whatever. And another way to do it too is you guys all weigh your patients when they first come in the building, right? And so monitoring their weight throughout the time that they stay there is really important. So if your patient starts gaining a ton of weight while they're there, that might mean that, hey, we are giving them too much fluids and they are not urinating out all of that fluid that we're giving them. Like granted, yes, they might have been dehydrated, and so they're going to gain a little bit of weight, but we don't want them to gain like 8 pounds while they're there, right? So we need to kind of make sure that they're not gaining too much weight. So one way to kind of remember that is that about 500 mils equals a pound. So if your patient is gaining like multiple pounds, then you're going, okay, well, they're obtaining about 500 mils extra in their body. So,
is there any medications you give as well to help the animal, like with the poisoning of the antifreeze?
Oh, for the antifreeze. So a lot of it is just supportive care with diuresis of like fluids and stuff to that nature. We also for them have to monitor for any kind of cardiac arrhythmias and stuff of that nature too. So if they start showing any arrhythmias or anything to that nature, we have to supportively treat that. So whether it's like lidocaine or cardiac medications of that stuff, they could also show like a metabolic acidosis or any type of oh my gosh, you know, weird, oh goodness, like if they have electrolyte imbalance, that's what I was trying to think of. I'm like, electrolyte, what's the word? If they have an electrolyte imbalance, we just supportively treat that like within their fluids and stuff. But unfortunately, there's not like an antidote that we can give them for necessarily the ethylene glycol per se. Now, one thing that we can do is that we can give them, I lie on the antidote, honestly. So one thing we can do is there is something called 4-MP, like number 4 and then MP. The antidote is the name is fomenzipole, FOMEPIZOLE. The problem is that it's really expensive. So not a lot of practices keep it, you know, in their hospital. So like if you work at a general practice, they don't keep it in their hospital. Any of you guys in your practice have any bottle of grain alcohol? Like notice somewhere within your hospital that you have like
vodka?
Yeah,
Yeah.
vodka.
Mhm.
Okay, so do you know what that's used for?
Mhm.
Not a hard day at work that you use it, you know? Yeah.
I have seen the bottle of vodka in Apple Pearl. I can't think of what we used it for.
Okay, so because the 4-MP is so expensive, we can use your grain alcohol, right, your vodka, as the antidote for ethylene glycol. So what we end up doing in these cases, what I have seen is that we mix the alcohol in with fluids and make like a CRI of it and give that IV to your patient. So it is probably for me, I think it's extremely scary because if you think about it, like you are giving your patient alcohol, and as you guys know, like we're all adults, and so you remember, like if you're going out partying and doing all of that, you definitely do not feel good, right? When you had a hard night and all of that, and you're doing that to your patient, and we have to remember to supportively treat them through that, like not a very good party, right? That's not a good party for them. They feel like crud through that whole process. And so we have to remember, like, their blood pressure could go down pretty bad. They feel really crummy through that. And then when they are finally done with that CRI, they're going to go through really horrible hangover on top of that, right? So I feel really bad for them. So that's part of the antidote, is to try to like metabolize all of that, and it is not a fun process for those guys. So if you do
And
have that antidote, then that's great.
and then isn't alcohol kind of considered a toxicity too?
Yeah, definitely. So right, you can have an animal come in with alcohol toxicity on top of it. Yeah.
Our instructor, he was an older vet, so he talked about that in our class. You kind of keep them drunk just because the more that, like, just how, you know, if you drink, you pee a lot and stuff. So the more that they are urinating, the more it doesn't have time to absorb. So he said that he would go to that, but that makes very sense in the end. Like, is it really the best thing for them?
Yeah. Yeah, it's tough. So you have to give all of this like within the first 8 to 12 hours of ingestion. So like Justina talked about, I think it was Justina that talked about, if you had an animal that came in 24 hours post, it's not going to be helpful. So
I
I
have the same instructor as Madison, and he also said that when you drink alcohol, it shuts the receptor off in your brain that lets you absorb water. So that's why you pee so much.
yeah. Yeah, so yeah, that's interesting. So yeah, if we can just get everything to flush through your system, then that's totally fine. But at the same time, when you're giving that alcohol, like it becomes this whole, to me, these patients are really obviously depressed is a very light term, right? Because we have to make sure that we are monitoring them really well and supporting them through that whole process of just feeling really crummy. And then even afterwards, they're going to feel pretty crummy. So
does it permanently damage anything for the dogs?
Yeah. So just like anything, any type of toxicity, and we have to remember, like, when we do anything to our body, like our kidneys or our liver and whatever, like our liver is a little bit different because our liver can regenerate pretty well, but it could definitely damage your kidneys pretty bad. So even if they can recover from this, it can definitely damage your kidneys. So whether they're still function, they may not function at their full 100%. So it's something to kind of keep note of, and especially advise owners too, that they may not still be at their full function afterwards, and it's something to monitor even afterwards and stuff.
That tiny puppy that came in, the veterinarian was trying to get him to go to the U of M to do dialysis. But the owners didn't want to do that, but it was really sad. So they took the chance and put it on fluids. I think it went home, but I don't know if it was going to survive. I wasn't there later, but
yeah,
sad.
I have not seen one survive. So, but at the same time, I have not seen one go on like dialysis or anything like that either. So I think it'd be interesting to see if other treatment options have been successful too.
Yeah.
They die from kidney failure?
Yeah.
Okay.
Yeah.
It like crystallizes in it, right? And like almost hardens.
Yeah. Yeah, and you get, so like the one I remember really well, he was doing really great, and we were like, oh my gosh, this one is gonna make it, and he was really young and he was great. And it's actually like a really nice chow too, which, when you see a really nice chow, you're like, all right, you need to tell your friends, your chow friends, like to be just like you. And all of a sudden he like just turned like a whole 180 and stopped making urine and all of that. So it was pretty sad to see. So yeah, so ethylene glycol is just not a fun thing to deal with for sure. Okay, any other toxicities that you guys can think of that we see quite a bit?
I want to say rat poison and stuff. There's the two different kinds that soak. One goes really slow, neurologic, and I can't think of what it does. The other one makes you bleed out, right? I see a lot of that.
Yeah. So what are the rat poisons? What are
there's brodifacoum, and then there's starts with B2. Is it like bromethylene or no? I can't think of the other B one.
Bromethylene, yeah.
And then one of the two is neurologic. I always get them mixed up. One is like the anticoagulant one. Well, no, it doesn't. Yeah, it does not, like your blood won't clot. And then the other one is neurologic, but I can't remember which one is which.
One of them has an antidote and one of them doesn't.
So bromethylene, bromethylene is the anticoagulant one. So that is obviously the one where we have all grown to know for years and years and years, right? And so how do we treat bromethylene poison?
Vitamin K.
Okay, so vitamin K. And so vitamin K, if we catch it at what time?
Isn't it like been more than 2 hours or like something like that? Because at that point you can't make them vomit.
Okay, we can make them vomit within at least a couple hours. Yeah. I mean, I know a lot of doctors will make a vomit and then still treat with vitamin K, right? Like it doesn't hurt to treat with vitamin K. And then what happens if we're starting to see symptoms? Or what are the symptoms?
Do they get petechia?
Okay. What else?
Would they have a low hematocrit too?
Good. You can have a low hematocrit. What else?
Possible internal bleeding. So
Okay.
anemia.
Okay, internal bleeding where? It's the fun part, right? Finding where the bleeding is. They can have bleeding right anywhere, right? They can have it in their abdomen, they can have it in their chest. Anyone ever do or treat any rat poison when it gets to this point?
Do you do blood transfusions?
Yeah,
Okay.
you do a transfusion.
You can do a blood transfusion, good. What if you don't have any blood?
Activated charcoal.
Okay, we can do activated charcoal too, like if it's prior to, when
If
they
you
come in.
have blood, would you do fluid therapy?
So we could do fluid therapy because we have to, they're hypovolemic too, yes. But what if you don't have blood and they have like bleeding in their chest or their abdomen?
Isn't it immunoglobulin transfusion? I can't think of the name of it.
Oh, you're probably thinking of
That's kind of like blood in a sense. You know what I mean?
Are you thinking of oxyglobin? Like old, it's like, we don't have oxyglobin here, but they do in the UK. We used to have it.
I've seen it. It was an immunoglobulin. It was a protein transfusion to help this little dog. I don't know why we were giving it.
Oh,
But they
okay.
explained it to me that it was a protein, kind of like a blood transfusion, but it's
Yes.
not quite blood. You know what I mean?
Yes.
What is that?
So immunoglobin we would use for, if it was for a puppy, that was probably if it was like a parvo puppy or something like that.
No,
But
it wasn't parvo because she was out on the main floor, but I know it was a little dog, and
Okay.
the girls were explaining it to me that they wanted a senior tech to do it because it wasn't your normal transfusion. You know what I mean?
right. It was probably just due to the fact that it needed some sort of immune booster per se.
Oh, okay, like autoimmune disease.
Yeah, some sort of
Okay.
immune booster. But in this case, we need red blood cells. So if this dog has red blood cells, or we don't have blood in our hospital, but he has blood in his chest and his abdomen. What can we do?
Tap it and pull it off.
You can do an auto transfusion for sure. So as long as you do it sterilely, you can give that blood right back to him. Because there's nothing wrong with his blood. It's just that he can't clot.
I actually saw that on a spay when I first got my job at Blue Pearl ER. It was crazy. The dog like came in from the DVM. It was bleeding out. They were pulling the blood with syringes and literally giving it back to her. And then she went to surgery. It was the craziest thing I've ever seen. I literally just started in the field and I'm like, what is happening?
Yeah. And it was probably because she was bleeding from the spay, right?
Yep. It was, from her spay area.
Yeah.
Yep.
And so there's
It was her
nothing
own
wrong
blood.
with the blood. It was
Yeah.
just that she was bleeding. Yeah.
But they couldn't pull it fast enough. It was the craziest thing. Yeah.
Yeah.
The ER veterinarian was very shaken by that. But she
Yeah.
lived. It was crazy.
Yeah.
What kind of transfusion did you call that?
It's called an auto transfusion.
And you mean, how are you pulling the blood out? Is it like through like the veins and then you're putting it through another vein, or how do you?
Yeah,
how
so
are you doing it?
are taking it out of the chest or the abdomen, just like you would tap your, whether it's like a three-way tap cock type of thing, right? And you're pulling it out and doing it as sterile as possible. And then you're gonna take it out and then give it to your patient through their IV catheter, like a transfusion. But it's just their own blood.
Okay.
And Beth, really quick, I think it's because I'm probably thinking about like colic surgery and like bacteria being introduced into the abdomen. So we can do this as long as there is no other puncture or concern, like in the case of the spay, that they didn't like puncture a gut or anything like that, right? Because that would be unusual. Okay.
Yeah.
Okay. So as long as it's only just seeping out of the veins.
Yes.
Okay.
Good point. Thank you.
And then we still treat this patient, right, with our vitamin K injections and stuff like that, because that's what they need, right? But we have to still supportively care for them because they currently have a low hematocrit. Obviously, at this point too, this patient is probably having a really hard time breathing because their red blood cell count is really low and there's like no oxygen going anywhere because there's such low red blood cells being able to travel everywhere. So probably going to benefit from being on some oxygen. And they're probably feeling pretty weak too. So, just kind of supportively caring for them. But the nice thing is once you can kind of maintain and give them blood, they're going to feel really a lot better very quickly. So those are kind of fun ones to treat and make them feel better, but it gets kind of scary when they come in and there's blood where it's not supposed to be. So, okay. So the other one that we talk about is, cholecalciferol. I can't ever say it. Cholecalciferol. And that is I'm sorry.
Can you spell that?
Yes, CHOL ECALCIFEROL.
Thank you.
Of course. So that is our vitamin D toxicity.
You said vitamin D toxicity?
Mm-hmm.
Okay.
How do they get that?
So there are a number of different rat poisons, obviously, that are out there, right? And so this rat poison, what happens is, right, is that they put, and I literally hate this rat poison. I guess no rat poison is really great, right? But this one's really sucky because to me, I feel like this is even more torturous to some effect. I don't know. It just seems that way. But vitamin D, right? We give vitamin D. And so what happens in this case is that we give vitamin D, and right, we know that vitamin D, it helps with helping calcium into bone and other areas, right? And so in this case, it's a vitamin D overload. And so this vitamin D, we know, is a fat soluble vitamin. And what it does is it overloads the kidney. And then in that case, it will calcify within the kidney and take its sweet time to cause renal failure, and then our patient will die. So the really hard part about this is, how do we treat this patient with a fat soluble vitamin, right? Like an overloaded fat soluble vitamin. Right? So we had another rat poison, which we were able to treat previously. Okay. But now we have one that's a fat soluble vitamin. So somebody mentioned earlier, like, one we can treat and one we can't treat. We actually can treat this one. It's just harder because not everyone has a treatment option in their hospital, and it is somewhat more expensive. So what do we need to do in this case? You have to know a little bit about pharmacology here.
Administer a surfactant.
Sorry, what did you say? Administer what?
She said administer a surfactant.
Sorry, I might be saying it wrong.
What would be surfactant?
Okay, again, not to speak for you, Aries, I don't know, you're on mute, but like a peroxide, right? Or
oh, okay. Okay. So we can administer, yes, we can make them vomit, right? So yeah, if we gave them like apomorphone or anything like that, to, yes, 100%. So, but if we get to the point where it's past like the couple hours or whatever that they have already eaten it, then how do we treat them?
This isn't like right away, but I know you change their diet. Like if you can get them back to normal, you change their diet to reduce the amount of vitamin D they're getting
Okay.
until it's at a normal level.
Okay.
I don't know what you do right away, but
Okay.
Is there like another type of medication that will bind and they could excrete it?
Ooh, yeah. There is a binding agent.
Can't remember the name.
Yeah. Think what will bind?
It's not charcoal, is it?
No,
Like fiber? Like something
it's
fibrous?
not a fiber, but you're on the right path. Remember that it's fat soluble, right? So the body needs to already have fat in order for this vitamin to work, right? And the problem is that if your animal has so much fat, then it will go into that animal's fat. However, if there's more fat involved, then it will go into that additional fat, right? And then it won't be as bad, right? So what can we do to kind of help that? This is why some hospitals may not have this in their hospital, where it becomes a little bit difficult. So, do any of you guys have lipids in your hospital, like IV lipids?
No.
Yes.
Yeah,
Is that the one that comes in the glass bottle?
it
Or
can
no?
come in a glass bottle. Yeah. And then it also can be in just like a regular bag of fluids too. But I've seen them in both, but they are white. So essentially what you're doing is you're giving your patient literally fat, right? Lipids, fat, and you're giving an IV to them. And then what happens is that vitamin D is going to be absorbed into that fat, and then that body is going to excrete the lipids, so that it won't be absorbed into all the fat of the patient within itself, right? So it sort of binds to that fat or gets absorbed into the fat. The problem is that what happens when we eat a ton of fat all at once? Or if you guys have not eaten a ton of fat all at once, I don't know, but how do you
Diarrhea?
feel?
Diarrhea.
Yeah, you don't feel so well, right? Like your body doesn't go through, it doesn't go very well, right? So your patient, or like what happens when we say to owners, like, what is it, Thanksgiving or Christmas or whatever, and owners are like, oh, I'm gonna give my animal like all these yummy goodies or whatever. Like what happens? What do we see a lot of when
Pancreatitis.
pancreatitis, right? 100%. So think about that. Like we're giving like straight up fat to our patients right now, right, to help them. But the problem is that we do risk our patients getting pancreatitis because of this. So we do have to treat them supportively through it. So like you guys said earlier, like giving them fluids as well, supportive care because they may have some vomiting and diarrhea on top of that as well. Yes, we need to look at their diet afterwards to make sure like what's in their food too. So not only just the vitamin D that's in their food, because yes, there's vitamin D in their food, but it's not really that much. But again, they have had like a ton of vitamin D, so we don't need to add to it. But also looking at fat content, probably feeding them something bland for a while, it would probably be good for them. Just depending on how they're doing. And just treating them supportively if they have some GI upset and all that jazz. So.
And Beth, sorry, I haven't seen this. Is the lipid treatment oral? You give the lipids oral or IV?
It's IV.
Okay, and this might be a silly question. Does it matter like what kind of lipids it is? Like, can all animals take the same kinds of this?
I believe it's the same because
Okay.
we've gotten it from human hospitals. So.
Oh, wow. Okay, cool.
Yeah.
Thank you.
Yeah. So that's kind of the nice thing too. Like if you guys live in the middle of nowhere and don't have, like an ER near you or whatever, you can reach out to your human hospitals and ask if you can buy something from them. So. Because I do know that it can be hard to find certain things. Like we've gotten human albumin from our hospitals nearby before. Sometimes when they're really busy, they haven't been able to do it, but nice to be friends with your human hospitals too. So those are our rat poisons. Again, as you guys know, I'll keep preaching. It's really, really important to have a clear understanding of our nutrition on top of that, because it does factor in at the end of the day. So I'm glad that whoever mentioned it, I'm sorry, I forgot who mentioned it, of looking at that nutrition as a factor. I'm glad your doctor does that. That's really awesome. All right. So what other poisons do we have that we see a lot of that can attribute to that we see that can attribute to renal failure? See a lot of in cats.
Acetaminophen toxicity.
Oh, acetaminophen toxicity. I wasn't thinking. Okay.
Oh, Jennifer, that's what I was going to say too. I was going to say Tylenol.
Tylenol, I like talking about Tylenol toxicity. So yeah. Okay, so acetaminophen toxicity. All right. So what does acetaminophen toxicity cause essentially? Or why are we so like scared about Tylenol toxicity?
Well, it'll kill a cat, right? There's like no way to bring a cat back, right? Or it's pretty
Cats
dangerous.
are very sensitive to Tylenol, yes.
Well, obviously, it does something to the kidney and liver, right? To like put them in failure or isotemic.
It definitely causes liver damage for sure.
Cats can't metabolize it, right?
So correct, they cannot metabolize acetaminophen. So with so with so cats have a very, very low dose that there's no like safe dose, right? They have a very, very small dose that they can produce signs of toxicity too. What about dogs? This is like a really interesting one too, because if you live in Europe, you may use Tylenol in dogs.
It's not as hurtful to dogs because I'm pretty sure that they can metabolize it, unlike the cat.
Okay, so yeah, they can definitely metabolize a small amount of Tylenol. And like I said, in Europe, they actually do utilize Tylenol in small doses. So in Europe, they do some interesting things that we do not do here. And I'm sure that they would probably say the same thing about us here in the States, on how we treat patients. So it's fun to be able to like talk to people about like how they give carprofen IV, and we're like, what? We wouldn't do that. So it's just interesting. So it is still, I would say, like we still have Tylenol toxicity in dogs and cats. We probably will not give acetaminophen to dogs or cats, but we do have to be cautious when giving, or if I should say, if an owner gave Tylenol to a dog or especially a cat. So what are some signs that we see with Tylenol toxicity?
Weakness or depression?
Okay, good. Weakness, depression, what else?
I know it affects their red blood cells, but I'm not really sure like in what way.
Okay. Anyone want to help that?
Well, it doesn't let the oxygen be carried by red blood cells, right? Red blood cells can't carry oxygen to other parts of the body.
Somewhat. It will carry it.
Would they experience like hypoxia maybe? Like,
Yeah.
and like would they have like increased like heart rate?
Probably heart rate just due to like anxiety from not being able to breathe. Yeah. So you mentioned that they can't carry oxygen to where they like tissues and stuff. They actually can carry the oxygen to where they need to go. The problem is that the oxygen can't get off of the hemoglobin. It's like stuck there. So when that happens, the hemoglobin dies off with that oxygen there, right? And so when that dies off, it turns that hemoglobin brown, right? Because that's what the hemoglobin makes that red blood cell turn red, right? That's what we see. And that's how we see like our nice pink gums. And that's how we see everything be nice and red and pink and wonderful and healthy, right? So when we see these red blood cells and the hemoglobin and stuff, when we see all of that turn brown, then what happens?
Jaundice?
No, we're not going to see jaundice per se.
Blue.
No, not. We might see some signs of being blue, but our gum color actually turns a different color, especially
Gray.
So like,
gray.
is it like really bright red, like brown reddish?
It's brown. They turn brown. So you may see a little bit of blue, but they actually turn brown because remember that hemoglobin and stuff is turning brown. So the appearance is going to be brown. Okay. So that is a huge clinical sign for you guys to be like, did your pet get into any Tylenol or anything like that? Because their gums are brown. And then another thing is that they can't breathe, right? They may have a little bit of blue to them, you know, but you're going to start seeing that brown.
So even if you started them with on like oxygen, like it wouldn't really matter because the hemoglobin can't even kick it off.
Yep.
Okay.
It sucks. It really sucks.
Yeah, that does suck.
Yeah, it's a horrible, horrible thing. Okay, so remember there's an antidote. So what is our antidote to this?
Does it start with like N dash
Yep.
I don't know. I can see the package,
Yes.
but I don't know how to say it.
Yes, so it's called acetylcysteine.
That's in pill form only, right?
So it is actually, so you can get it in injectable.
Okay.
And so we used to give it IV, but we have found that it actually gets absorbed a lot better if you give it orally as well, rather than injectable. So it also tastes terrible. If you ever draw it up, you will smell it. It smells like rotten eggs. It's awful. It's an awful, awful, awful smell. So you can draw it up and then like super dilute it down with water, and then give it to your patient. The also really cool thing about it is that acetylcysteine will work for your patient, but there are certain drugs that work better when they're given with other drugs on top of it. So like when you have a dog that comes in that is a dystocia, right? And it has a bunch of puppies and we need to, give oxytocin. We'll give it oxytocin, but oxytocin will actually work better if we also give on top of that calcium gluconate. So there are certain medications that we can do that will work better if we actually give other drugs on top of it. So some doctors will do that. So acetylcysteine will actually work better if we give vitamin C with it. So you may see your doctors in combination do both of those drugs. So acetylcysteine, they'll give that several times to help with that. Plus, on top of that, we for acetaminophen toxicity, they will be in the hospital, obviously, and being diuresed for quite some time, quite a few days.
Okay, super random. Before you move on, remember we talked about mannitol last week?
Yeah.
Okay, so we had a dog hit by a car, swollen brain, really bad, neurologic, can't stand. The only thing I don't remember talking about was the filter. I was like,
oh yeah.
And so it's the only part that I didn't know, but it was nice to had just talk about it and then in action. You know what I mean? So.
Yeah. Yeah, the filter is definitely important just to make sure that you don't have any like micro crystals in there or anything for that nature given.
But I was like, oh, there's supposed to be a filter. That was the part I did not remember. So,
yeah. Okay, so another toxicity that we see, right, for renal patient or that can cause renal issues, right? Especially we see a lot for some reason in cats. In certain time periods, and we'll probably see soon enough, right? Is what? See if you guys guess it.
The lilies.
Yeah, lily toxicity, right? And we have quite a few different types of lilies, so it gets really interesting because then we have to start becoming like plant experts to know what actually is a lily, because of course, there are a lot of different subcategories of lilies and stuff. So, what happens with lily toxicities? And it doesn't have to be just like why is the cat? Like, is there a lily toxicity in dogs?
I thought tiger lilies were, but I think it's like really low. Like they have to eat a ton.
Okay.
I think I have them in my yard and it makes me paranoid, but no one really messes with them.
Yeah.
Is it the pollen that's really dangerous to the cats though?
It's any part of the plant is my understanding.
Okay.
Yeah.
We had a woman bring in 14 cats because she doesn't know what cat had eaten it, and she paid thousands of dollars. It was amazing. And we had that whole ICU full. And only like 2 or 3 ended up having like, the serious signs that had to stay. But it was like that lady, oh my God, has 14 cats.
Yeah. So yeah, go ahead.
Lily's only toxic to cats?
Correct. So in dogs, the general idea obviously is that dogs, of course, if they eat them, they can have like GI symptoms for the most part. Sometimes they may like have some pawing at their face, like it might just be irritating to their mouth or whatever. The only thing is if you have like lily of the valley, they can have some like heart arrhythmias or something to that nature, but there is like no major like renal issues that you see like you do in cats. So now same in people, like people, if they eat a lily, which of course I don't know why anyone would eat a lily, but if you do, you would also have GI symptoms as well. So just don't eat a lily.
And then I just have one more question.
Yeah.
Are we doing today's class about toxicity? Because when I was watching the emergency, you at the end of the video you were like, I'm gonna take a break and do the toxic video in a little bit, but it never got posted.
Oh, yes, I'm gonna do today's on toxicity. Yeah.
I was like, I was just wondering, I was like, that's probably why she's doing it in person, because online, it was like, you're like, oh, I'm gonna do another one about toxicity. And that's where like it ended.
Yeah. Yes, today's is on toxicity. So with cat lily toxicity, what are our initial signs that we see in cats when they might eat like a lily?
Isn't it like hypersalivation is one?
Okay, good. So we'll see like hypersalivation. What else?
Any vomiting?
Yeah, vomiting. They might just be like loss of appetite too. They could be lethargic. So a lot of like GI upset right away, just kind of like dogs too. And then after that is kind of when things start settling in. So how long does it take for them to kind of develop that kind of renal failure and stuff?
Is it like within 24 hours or?
Yeah, you can start
Okay.
seeing those signs in like 12 to 24 hours for sure after they ingest that stuff, lilies, right? And it could definitely be fatal if it's not treated within 72 hours for sure. So it's something that people 100% need to, be really cautious with. So, I have multiple cats and I absolutely love lilies, but unfortunately I can't have them in my house just because I do want to be very cautious. So I just put them outside my house when I need them. So when we treat our lily toxicities, how do we treat them?
Fluids.
Fluids?
Yes, lots of fluids, right? And
GI supportive care, like
yeah,
GI?
GI supportive care, right?
I
So
give
as
up,
yeah. What else?
might give them an antiemetic if they're still vomiting, but this might be like way after clinical
Yeah.
signs.
Yeah. So yeah, if they're still vomiting, antiemetic, because again, we don't want to lose any more fluids, right? We want to keep all that fluid in so we can supportively treat them. We also want them to continue to eat if possible because we want them to take in as much fluid that way too and gain some additional strength and feel better and all of that. So antiemetics is great. If they're having any diarrhea too, we want to treat that too. So you're right, like all supportive care as possible. Anything else?
Would you have to put a feeding tube if they're not eating after so long?
Yeah, so I mean, that's like definitely like last case, of course. So, typically we would do some type of feeding tube, like if it's at the most like 5 days post if they're not eating. But typically we can get them to start eating something with, some sort of supportive care and really yummy different foods and stuff to that nature. And being that it's a toxicity, we may want to give something to try to bind some of those toxins too that are still remaining in the stomach if they come in early enough. So what might we give? Which is really hard to give in cats. So
Activated charcoal.
yeah, activated charcoal, right? Like, ugh. I don't know. Terrible to give in dogs most of the time, and trying to think of giving it in cats is just even worse, right? But sometimes we'll do that. Again, in these cats too. So anytime we're thinking of renal issues, we always want to remember that we need to monitor urine output, right? So urine output's still going to be the same of that 1 to 2 mils per kg per hour. So we want to make sure that we're monitoring that as the technicians too, to make sure that they are still producing as much urine as possible. So they're probably not going to have a urinary catheter in, but we can monitor the, if they're in the hospital, of course, we can monitor their litter box to make sure that they are still urinating appropriately. Of course, cats are interesting in the hospital because sometimes they don't want to urinate, but just keep checking their bladder size and stuff too, to make sure that they still have a really good bladder size and that they will urinate at some point as well. And then we continue to monitor their blood work too as they are hospitalized. So if they're hospitalized for like many times, how many of you have seen Lily toxicities in practice already?
I think I've seen a couple.
A couple? Okay. How long do you guys keep them in your hospital?
Oh, it's been a while.
Yeah.
I think it was about 3 days, and like we rechecked blood work and stuff before they
Good.
left, urine, all that.
Yeah. I was gonna say we usually keep them about 3 days because that's usually, remember, like the fatal time, right? So we want to make sure like we keep them through that process of, hey, we have that 72-hour window. We want to try to keep them hydrated and diuretic through that time. And then you got to monitor that blood to make sure that we are in the clear through that time, even though 3 days seems like a really long time. And we get that, but we just want to be really cautious. So, very good. Awesome. So thinking of another toxicity that we see a lot, this one is not necessarily a renal one, but we see this one all the time. Is chocolate toxicity. How many of you have seen chocolate toxicity?
Yes, we had
a few.
We had a dog that ate, the cocoa in the powder.
Oh yeah.
Yeah, half of it was disgusting.
Yeah, so we will be seeing a ton of chocolate toxicity coming up very soon, right? It's always Valentine's Day, right? Easter, and oh God, any holiday you can think of is, chocolate toxicity days. So what is the ingredient that makes chocolate toxic to animals?
And this is dogs and cats, this toxicity.
I mean, I always say dogs because I see it in dogs, but oh gosh. I want to just check. What the toxicity is in cats really quick. Yeah, toxicity is in cats too, but I want to make sure what the dose is in cats. It's 200 milligrams per kg in cats.
So I wasn't sure, so I did look it up. It's methyl, I can't say it, methylaxine containing in chocolate products.
So in chocolate it's theobromine.
What is it?
Theobromine.
Okay.
Yeah. So the the dosing for theobromine in dogs, so that makes it toxic to dogs, and that's lethal to dogs. That lethal dose is somewhere between 100 to 500 mg per kg in their body weight. So it does just depend on the type of chocolate that you're dealing with too, and all of that jazz. In cats, it's 200 mg per kg, so you're still dealing with all of that. Now, I think we see a lot more of chocolate toxicity in dogs, for probably a number of reasons. So an interesting like side note is that dogs really like sweet things. They like sweet tasting things. So they do tend to go for those like chocolate and all of that. Cats actually tend to go towards more salty type of products. Salty and savory they like. So that's just a side note. It's not to say that cats won't eat chocolate, but they do tend to go to more salty, savory type of foods.
You said for dogs it's 100 to what again?
100 to 500 mg per kg is the toxic, or I'm sorry, the lethal dose of theobromine. And that is the ingredient in chocolate that is toxic to them. Now, there's also another toxic thing in chocolate too that we have to consider as well, right? The other toxic thing in chocolate is caffeine. So, when we have animals that come in who have had chocolate toxicity, what are the things that we will see with them that are some clinical signs?
A tachycardia. So we usually put
okay, so tachycardia.
Yep.
What else?
Maybe possible seizures.
Okay, yeah, possible seizures for sure. Like that's definitely, you know, when you know for sure, like, okay, we've gotten into some really bad things. What else?
Lethargic, maybe?
They may be lethargic, but typically not.
Don't they actually get jittery from the
Yeah.
caffeine because it's so overwhelming?
Yes. So it's like a stimulant to them. So they are actually, yeah, you're right. They're more hyperactive. They're more like, oh my God, something's going on crazy.
We saw a dog at my GP clinic that got semi-sweet chocolates, but like 2 bags worth.
Oh wow, okay.
She was drooling, but I can't quite remember.
So if she's drooling, she's probably more like nauseous.
Okay.
So, and that can be 100% like a clinical sign because they can have some vomiting and diarrhea too.
Okay.
Which I mean, I would too. That's a lot of like number one sugar, you know, for anyone.
Oh, so good though, going down.
Oh, sure. Yeah, 100%, man. Oh. But the big thing to worry about in these guys is their tachycardia, their blood pressure being super, super high, right? And yes, the fact that they can go into and have a seizure, you know, just from being so crazy, right? So what is the really bad thing that we deal with theobromine? Like, they can eat chocolate and, you know, it can go like 24 hours and they can still be feeling these symptoms, correct, at home. Why is that?
Does it take a while to absorb?
So, no, it absorbs pretty quickly.
Mm.
What happens with theobromine? They even maybe in your hospital and like you have them on fluids and everything, and maybe, you know, the animal isn't wanting to pee outside and you're still seeing symptoms.
Central nervous system. They can't get up and walk.
Okay.
They goofy from it or weak.
No.
No. Okay.
What happens with theobromine in the bladder?
Inconsistency. When they when like it's kind of gets neurological and then they can't feel when they need to pee.
Okay. No, not necessarily. So theobromine actually can be reabsorbed in the bladder. So you can be diuresing your patient like crazy, and then it gets to the bladder. And if you don't empty that bladder with the theobromine that's in there, it will reabsorb in the bladder and then just continue that process. So it's really important that if you have a patient that is a chocolate toxicity, that you either place a urinary catheter or you walk that patient like every single hour to empty the bladder so that theobromine doesn't reabsorb. Especially if it's like a really bad chocolate toxicity. So like I had my own dog because she's naughty. She ate like, she's a little like 13-pound mixed breed dog. She ate like, oh gosh, probably a whole package or like 3/4 of a package of semi-sweet chocolate chips, right? So that was a lot. It was definitely a lethal dose of chocolate. And I was working all day. I came home at like 9 o'clock at night and like no one told me what was going on. And then I get home and then of course my husband goes, yeah, she ate this, you know, this morning, and she had been like throwing up, and she was super tachycardic, and I could feel her pulse like just bounding and bounding. And I was like, okay, well, you know, I'm just going to bring her to work tomorrow. And like, you know, I wasn't going to bring her to the emergency because I was just going to be at work literally in a couple hours. And I was teaching at the time. So I was like, this is going to be a great teaching case. So I brought her to school and we gave her medication, and we put her in, we sedated her and placed a urinary catheter. So all my students got to, you know, see how a urinary catheter on a female dog was placed and stuff. Oh my gosh, she was so much better in like 2 hours and wagging her tail and loving the urinary catheter and everything. But it was like nothing ever happened to her. She felt so good afterwards. She just needed some fluids and that urinary catheter placed so that she could get that theobromine out of her system. So
Is there a way to tell how much of the caffeine and the theobromine is in the chocolate that they ingested?
yeah, so there are a lot of different calculators out, of course, on the internet too, to be able to know like what is a toxic dose. So if you like ask an owner, how much chocolate did your animal eat? And then knowing like how much they weigh, you can calculate what is, you know, a lethal dose or a safe dose or whatever. But of course, it's always good to make them vomit regardless of, you know, when they ate it or whatever. Another good thing too is to always give them charcoal afterwards too, so they can bind that theobromine as well. That'll be really helpful. So like in her case, I still gave her charcoal too, even though it was like way past, you know, that time, but it did help, of course, bind some of that theobromine and caffeine. But in cases of looking at it, like in cocoa powder, so Justina, I think you said, like there was an animal that ate cocoa powder. There's 800 milligrams of theobromine in 1 ounce of cocoa powder, which is a lot. In dark baking chocolate, there's 400 milligrams in an ounce. So that's comparatively, that's a lot, right? Semi-sweet chocolate is 150 milligrams in an ounce. So cocoa powder, there's so much. Milk chocolate is 60 milligrams in an ounce, and then white chocolate's less than 1 milligram. So white chocolate's like barely anything at all. But in your case where you said like the white chocolate, that dog ate 2 packages and was drooling and felt really crummy. You know, it still means a lot that, hey, these animals do get sick. It may not be because of theobromine. They just feel really sick because they ate something really bad too, right?
Yeah, and it was a big, like kind of a fat chocolate. I think she was old too, and I'm like, what
Yeah.
are you thinking?
Yeah, right.
But she just looked like down and out, just
Yeah.
sitting there.
Right. So she made a poor choice, and that's okay. So, but in the same sense, like we really do we do take those things seriously in that case, and then just treat it supportively. There's no harm in giving charcoal in those cases anyway. And like you said, if it's an older dog, like we take that into consideration, like how are the body functions too, and that if she can't like metabolize that stuff as well as the younger dog too, then there's no harm in giving anything. But when we look at these things, like a semi-sweet chocolate compared to a cocoa powder, like semi-sweet chocolate is some strong stuff too, but compared to a cocoa powder, like that's a lot of theobromine. So if you had an animal that got into cocoa powder, like they need some intervention quickly, you know?
I think they vomited her right away. But we had to like try to figure out how much she ate. The owner was smart and brought in the container, but I was like, how's that even tasty?
Right. Yeah. So I think, you know, this is obviously a toxicity that we see quite frequently in our ER, in our general practices and stuff too. And then if you guys even work in urgent care, these are things that we see a lot, and they usually are easy fixes. However, some of them can become really critical cases that we do have to you know, look at and say, okay, well, now we have some cardiac issues that we have to deal with. Like it can become a cardiac thing that we have to treat and be really cautious with because they have eaten a lot or anything, or just like in my dog's case, like she did need a urinary catheter, and just being on top of it and doing those things to make them feel better ASAP can save you from having long-term effects too. So, yeah.
We have enough time to maybe chat about, I've seen a lot of, now that, you know, gummies, you know.
Oh yeah.
I've seen a lot of that.
Yeah.
Marijuana ingestion or whatever.
Yeah. That's a good one actually. So, if you guys have had THC toxicities in any animals and stuff that have come in, especially, you know, if you are living in states that
legal.
Yeah, where it's legal to have a lot of this additional things too. What are some of the things that you see in clinical signs of THC toxicities?
I've seen they're very jittery.
Okay.
Like you know, like shaky in a sense. They dribble urine.
Yeah.
They're light sensitive. So we try to shut the lights off for them. all I can really think of. I knew a case where the mom was a nurse and she was so embarrassed. She ate muffins, threw them away over the weekend, and then the dog got into the garbage and ate them.
Oh, so like a mold toxicity?
Yeah. So
Okay.
like the dog only, we did fluids. It flushed through and then she went home with, she didn't have to stay overnight, but it
Yeah.
was weird because she was really like out of it, like jittery, sensitive to touch and sound, dribbling urine. Yeah, it's interesting.
Yeah.
Interesting how it affects them so differently than us humans.
Yeah, most definitely.
I think I had the same experience we had 2 Great Dane puppies that came in, and unfortunately, like the owners weren't really telling us what was going on. So we were treating for nicotine instead.
Okay.
That's what they told us, but the dog eventually threw up a whole bag of it.
Oh.
So that's how we decided to start treating for marijuana anyhow. But we had the same experience. The dog was like jittery, it'd wobble around and it like dribbled urine. The other one wasn't so bad because the other one ate like all of it. The other one that only got like a little bit.
Yeah. Do any of you guys do drug tests on your patients when they come in?
I've seen one in the ER. A couple brought their golden retriever in. They didn't know what was wrong. They honestly didn't know what was wrong. The vet had said, "Are you sure your kids don't have drugs in the house?" And the owners were like, "Our kids don't do drugs." Guess what? That dog tested positive for cocaine.
Mm-hmm.
So the dog busted the kid. So the owners went back and checked the son's room, and it was the son's room.
Yeah.
Though they honestly had no idea. But yes, I've seen meth, cocaine. Yeah.
So do
Not
they
as often as marijuana, but
yeah.
Do they do the test like just like a urine test
Yeah.
kind of? Okay. I never
Yeah.
you could do that actually.
Yeah. So, and I think, the more and more that we see some of these toxicities, it's not a bad idea to have these available, obviously, because it's going to make it so much easier for us to be able to treat these patients a little bit more. And the idea behind it too is to say, like, we aren't going to, this isn't a way for us to get anyone here in trouble. We are here to treat your patient or your pet, obviously, and that is it. Like, this isn't to report you to anyone or anything, but we just need to know what is going on with your pet at this time, and that's it. So I think obviously phrasing it that way can make it a lot easier. And it, like you said, Justine, in the case of, parents don't know everything, and I have teenagers too. Like, I would like to think that I know everything that's going on in my kids' lives, but I don't. I know that. And so, especially when you have an animal who's really sick and you don't know what's going on, you have to kind of separate that and say, like, okay, well, we just need to know and figure this out. And hopefully it comes back negative. And if it doesn't, then there's something that needs to be addressed. And yeah, that's important. In the case of THC, so THC is something that we see quite a bit. And in those cases, these guys are really interesting because, like you said, they're a little bit different than what we see. They actually can be a little bit more sedate at first, but they are really exaggerated in the way that if you come up to them really like close, or there's like a loud noise or like light that hits them or something like that, they like jump horribly. Like, they're very exaggerated in response to things. They of course can have like vomiting or diarrhea or anything to that nature. The biggest thing I see is that they have urine that's dribbling constantly, as well. They can also have a low heart rate. They have a difficulty standing and walking, that type of thing. Sometimes they can be like kind of stretched out, just awkward in their stance. They can have seizures, go comatose, and even die if they, aren't treated or have a lot in the system. So it's interesting. So how do we treat THC toxicity?
Mostly just flush it out with fluids. is what I think I've seen.
Okay.
But I think it's when they actually like know what's going on. But I honestly can't remember. It's been a really long time since I got to see one.
I say besides us making the dog throw up, I think we just mainly did fluids. Besides when we were first initially treating for nicotine, I don't know what they administered then.
Anyone else?
Would activated charcoal help in any way?
Yes, it's very good. Activated charcoal for sure can be really helpful. So we can give them activated charcoal, hopefully that they'd be able to swallow that activated charcoal in appropriate, fashion. So that becomes interesting. And fluid therapy, obviously, to kind of flush their system and stuff to that nature. And then also just supportive care is a big one. What about lipid therapy? Anyone ever see lipid therapy done?
I don't think so. I can only see fluids.
Okay.
But I think because we're in Minnesota, it's legal. I think people are more open to tell us like, yeah, they ate, whatever. So, you know what I mean? Like they're not shy about letting us know.
Yeah. So in some pretty really bad cases of THC toxicity, you can do lipid therapy for them. But a lot of THC cases have been treated well with, like whether you make them vomit first and then doing, if they have just like ingested it or whatever, and then doing like decontamination and then doing your charcoal and then fluids. But like I said, if they have had a substantial amount where you're worried that they may have seizures or go into a coma or something to that nature, you can do lipid therapy to help try to bind some of that THC as well. So again, if you don't have access to like lipid therapy, then obviously that makes it a little bit difficult. Very good. Very good. That was a good toxicity. I forgot all about that one. And we see it quite frequently too, so. Awesome. Great. Any questions, guys, about this week and our toxicity talk?
No, but so next week, what do you want us to study?
Yeah, I know.
Just that's
It's so crazy. Okay, so next
I'm
week,
all over the place. So
yes, next week let's work on diagnostic imaging and dentistry. I'm going to figure out your guys' lectures and get them all on track again because this is crazy. But yeah, let's work on diagnostic imaging and dentistry. They'll be on track.
Okay. And I sent you a screenshot of what it looks like so you can see, because I'm sure you can't see it from the instructor side. So.
Perfect. No, that's really helpful. I appreciate that.
And Beth, I keep handing your information out because I have a bunch of friends. We're all graduating. So
good.
Tests, and I'm like, have you heard of Beth Armstrong? I've been trying to pass along your info a lot because I said it's such a great, just talking about stuff. It's so helpful.
I appreciate that. Yeah. I'm actually building some more courses now, so you guys will be able to see some more things coming along your way. So it's good. Awesome. Well,
We did this in March, so we'll keep
Yeah.
rocking it out.
awesome.
Is the recording from last week up already, or do you put it up
Yeah,
somewhere?
it should be up on your Moodle shelf for you guys. Let me just double check that I thought I was on the ball. I should make sure I have it here. So it is up. If you look in Moodle, it is all the way at the bottom under current Zoom, under the current Zoom study halls. And it is titled the ECC and CPR. It's the last one that's on there.
Oh, okay. I see it.
Yeah.
Thank you.
Of course. Yeah, I just list them in order for each week. Awesome. Well, you guys have a wonderful rest of your Sunday. And we will chat next week.
Thank you.
Thank
Have a good
you.
Of
weekend.
course. Have a
Thanks.
good day. Take care. Bye.